Okay, let's get into it. Today we're doing a deep dive on something pretty alarming. The rise in supply chain attacks hitting healthcare globally.
Hmm.
And we're zeroing in on this massive breach in Brazil recently. Got a lot of sources here.
Yeah,
We want to basically pull out the key stuff, how the attackers did it, the rules and regulations over there, and why healthcare is such a big target right now.
exactly. And the specific focus, it's this attack on MedicSolution. They're an IT provider,
Sure.
software for lots of clinics in Brazil.
Right.
And the group, KillSec, claimed it. We're talking huge numbers here, almost 95,000 files, over 34 gigs of really sensitive patient data.
Wow. And it's not just like basic info, is it?
No. The sources confirm it, lab results, x-rays, even unredacted photos of patients.
Patient photos.
Yes, and records involving kids, minors. It's serious stuff.
That's awful. But the way they got in, that's almost the most surprising part, isn't it? I don't know, super complex hacking?
You would think,
Yeah.
but no, it was what people are calling low-hanging fruit.
Low-hanging fruit.
Yeah. KillSec, they didn't need to break through complex defenses or use fancy malware. They found misconfigured AWS S3 cloud storage buckets.
Wait, cloud storage? Like just open?
Essentially, yes. Left vulnerable to remote access. They didn't really hack in the traditional sense. They more or less just accessed it, downloaded everything.
So hold on. A breach affecting potentially 95,000 patients happened because of a configuration mistake, not some advanced cyber weapon.
That seems to be the case, just an administrative error, a security oversight.
That almost makes the strategy scarier, targeting the vendor, the supplier.
It's strategically smart from their perspective, unfortunately. Hit MedicSolution, and suddenly you've compromised all the clinics and centers using their software downstream.
Like who? Any examples?
Yeah, places like Vita, Exame, Centro Diagnostico Toledo. Hitting the supplier, it sort of quadrupled the impact, maybe
So
more.
compared to just hitting one hospital, you mean?
Precisely. One entry point, multiple victims.
And looking at the bigger picture, this isn't just a one-off in Brazil, right? You mentioned KillSec.
That's right. It looks like part of a wider campaign, definitely regional.
Yeah.
We've seen KillSec linked to attacks in Peru, Suiza Lab, Dr.
Peru, too.
Yep. And Colombia, Gotel and Medicina, eMedico ERP, even in Archer Health in the U.S., all around the same time.
Wow. So a coordinated push across the Americas.
Seems like it, targeting these healthcare IT vendors specifically.
Which brings us to the regulations. Brazil's got that strong data law, the LGPD.
It does, Lei Geral de Proteção de Dados. And it treats medical records as sensitive personal data. That means extra protection is required.
And extra penalties if you mess up.
Definitely. There are strict rules.
Yeah.
Companies have to report breaches to the regulator, the ANPD, and tell the affected people.
Quickly.
Very quickly. Within 3 business days. If not, you're looking at potentially huge fines, sanctions.
And has that actually happened? Are there teeth behind it?
Oh, yes. The sector's already feeling it.
Yeah.
Just this year, 2024, the ANPD fined 15 healthcare organizations. Yeah, a total of 12 million BRL, mostly for lacking basics like encryption or having proper breach response plans.
So the regulators aren't messing around.
Not at all. And you have to ask why healthcare data is so valuable. It's the gold standard on the black market.
For fraud. Blackmail.
Both. Insurance fraud, identity theft is huge, and yeah, blackmail potential too. It contains everything. It's become such a problem that Resecurity, the intel firm, is actually offering grants.
Grants for what?
To help Brazilian healthcare providers afford better cyber threat intelligence services, just to try and fight this specific trend.
Okay, so let's pull this together. We've got an attack method that's alarmingly simple, this huge supply chain ripple effect, and serious regulatory consequences. What's the main takeaway here? What does this tell us about healthcare security going forward?
I think the key takeaway is that the old model, just defending your own walls, your own perimeter, it's just not enough anymore. It's becoming obsolete.
Because the attacks are shifting.
Exactly. They're moving away from hitting the big hospital directly and focusing on the often less secure IT vendors, the third parties that handle the data. So, supply chain resilience, making sure everyone in your chain is secure. That's moved from being important to being absolutely critical. It might be the biggest challenge right now.
Right. And that leaves a pretty big question for you listening. If these specialized software companies, the ones hospitals trust with thousands of patient records, are making basic mistakes, like leaving cloud storage open,
Hmm.
what does that suggest about potential security gaps in other vital sectors? Think about finance, energy, other critical infrastructure. They all rely heavily on third-party vendors, too.
It's definitely something to think about. How secure is the entire ecosystem when one weak link can cause so much damage?
A sobering thought to end on.